So thanks, Georgia. Evie, do you want to introduce yourself?
Sure. Hi, I'm Evie. I'm a senior officer in the health protection team. Yeah, I'm doing exactly what it says on the tin today, lunching and learning. So I'll probably have my camera off if that's all right while I'm eating.
No, that's fine.
Thank you.
And Chris.
Hi all, Chris Bagger. I'm a portfolio leader in the Public Health Division.
Brilliant. And Sue.
Hi, I'm an ED in the Public Health Division leading on addictions, and I'm going to lunch and learn as well, so my camera will be off. Nice to meet everyone.
Hi, and Georgia.
Hello, I'm Georgia. I'm an officer in the addictions team. Nice to meet everyone. Well, meet everyone I haven't met yet.
And for me.
Hi everyone. Fumi Worrell, interim service lead for health protection.
Thank you. And I don't want to ruin your name, mostly because I don't know if it's your first name, because some organisations put the first name first. Is it Niama? Naya?
Yeah, it's Ninaya.
Naya. Thank you.
Hi.
Nice to meet you, Naya. Fantastic. Okie dokie then. Shall we? I'm going to say, shall we start? And someone else is going to join, aren't they? Hi, Mark.
Hi.
Hi. Georgia, do you want to start the presentation? Oh dear. Fantastic. Yep. So this is our lunch and learn about local drug and information systems. And as the brief said, it's an interactive one. We've run this before, and I think it's a lot better when it incorporates all. And because I was told it was quite a large attendee list, I thought we'd get rich conversation through lunching and through learning. So next slide, please. Right, next slide. Is it me? Has it changed for anybody else? Or is it just me?
Is it not working? Sorry.
Oh, don't worry if it's. Oh, brilliant. Oh, back. Giving away my slides, children.
Is that working?
Yes. Yeah. Next slide, please. So what is a local drug and information system, or LDIS as it's known to us? It is a process of sharing and checking drug information. When necessary, it includes sending out drug alerts. Sorry, we're having it nets out drug alerts. It also receives reports about new or contaminated drugs that can be gathered from various services. Next slide, please. Why do we have LDISs, or why do we do it? Currently in Birmingham, the proportion of those in treatment who have died from drug-related deaths in Birmingham is 1.22%, which is lower than the national average. Current trends in drug-related death reveal that we're starting to see a decline in those over 30 and have the largest decline with those over 50. However, the trend is slightly different for those who are 18 to 29, where we're seeing a spike in death reported on NDTMS, and this group seems to be having a spike in drug-related deaths, whereas the older age group seem to be slower and a more steady increase and declines. The spike in the drug-related deaths is between 18 and 29 years old, and it is predominantly being observed by females. We can, using the eldest to monitor drug information, take action to prevent any further deaths in the priority groups. Next slide, please. So the process starts with data and intelligence that is gathered into our system. That information is then validated, lateral checks are carried out, and then actions are agreed upon. So, eldest has now been activated. We were going to break out into breakout rooms, but I think we've got enough to just have one group. So now the eldest has been activated, we would move through situations, and I ask you all to kind of join me and offer your thoughts as we go along. So next slide, please. So it's a warning for anyone in the room that the following slides involve discussion around death and drug use. So it is Monday, you're at work and the phone rings. Sadly, 2 men who were rough sleeping in the city have passed away, and it is a drug overdose. What would you do, and who would you inform? Just kind of think about that for a bit. Evie?
Sorry, more of a question.
Mhm.
Who would the call have come from normally?
Yeah. I didn't work out who the call would have came from. It could come from one of your stakeholders if you wouldn't. So we will say, because I know your health protection, you'll get a call from one of the community safety partnerships if it's in town, and they've called you at work and said 2 rough sleepers have passed away in the city. The initial obviously services such as ambulance and everyone have been informed, but yeah, what would you do? Who would you inform? It's just at the moment, just a thoughts, so we can bring it together. Sorry, next slide, please. I've just realised I'm not holding the slides. Okay, it is Wednesday. You're leaving work. The phone rings again. Female in supported housing is in hospital after a drug-related overdose. Another female has unfortunately died at the scene. What would you do? And who do you inform? Oh, have we? Yep. So it's a news flash. It's Thursday. You're at home and you're on social media and an article pops up. 5 teenagers have collapsed at a school. Another 3 pupils from the south of Birmingham are in hospital. Angry parents have asked for schools to be shut. What would you do? And who do you inform? Next slide, please. Oh, Chris.
Yeah, sorry, I've just I suppose given the information that we have, basically you'd want more information because there's no evidence that the same thing affecting the children at school is anything to do with either of the other 2 overdoses. And you also don't know if the other 2 overdoses are linked and the same substance either.
Fantastic.
So you kind of want to triangulate all of your data and understand what the actual facts you're dealing with are rather than just reports of problems out there in the community.
Brilliant. Fantastic. Thank you. Hi, Glenda.
So sorry, I had trouble logging on.
I've got somebody else has just sent a message saying the same thing. Something
It was a
about
nightmare.
Yeah.
It hasn't gone straight to my Teams. I had to go back into the link, and then they sent me another email. So I've been fiddling and messing around. So, sorry.
No, I'll just recap then. What we've kind of done is what is an eldest, and we're doing a kind of an interactive piece. George, could you just go back to the list of scenarios, and I'll raise Chris's point as well. So it is Monday. You're at work and the phone rings. Evie raised a good question. Who's the phone call from? So that's Community Safety Partnership. They've informed you that 2 men have passed away while they were rough sleeping in the city centre, and it's a drug overdose. So what would you do? Who would you inform? So we're kind of I'm walking everyone through this a little bit at the moment. It's Wednesday, you're leaving work, the phone rings again. We'll have a supported housing worker, and they said a female in supported housing is in hospital after a drug-related overdose. Another female has unfortunately died at the scene. What would you do, and who would you inform? Next slide, please. And then there's a news flash. It is Thursday, you're at home and on social media, and this article pops up. There's been 5 teenagers collapsed at a school. Another 3 in the south of Birmingham are in hospital. Angry parents have asked for the schools to be shut. What would you do? Who would you inform? Chris has said that at this stage, is it the same source? How do we know it's been the same substance or prevalence from the first slide to this slide? We need more information. Next slide, please. It is Sunday. Aston Villa. Oh, go back one. Aston Villa are playing. 10 men have been taken to hospital. What would you do? Who would you inform? Now, before you go to the next slide, Georgia, pause there. Now, to just bring in the discussion, Chris kind of guessed my ending before I got there, but of all those, so if you could kind of start to feed back to me, so what were some of your thoughts? What were some of the things that you would do? Go on, Glenda.
Is it food poisoning before we jump to the conclusion that it's drugs?
Good question. That's a very, very good question.
I'm just thinking of all them pies that they have.
It's a good word. For me.
Thanks, Candice. So I guess we're here to sort of get the detail. But I guess what I would do from a HP point of view is start to ensure that I'm speaking to all my key stakeholders, make sure that we have the evidence, kind of touching on what Chris said, so that we know what's going on. So whether it be colleagues in the acutes or colleagues in addiction services, CGL, etc., to start to put together a picture of what's actually happening using real evidence. If people have passed away, then maybe like the coroner's office and other key stakeholders. So just making sure that everybody is aware of what's going on, and then finding out whether, as Glenda said, it is a drugs or addictions issue, or whether could be a variety of other things, and then seeing if there's a link between all of them, if they're all just different separate things, and just sort of coincidental. So yeah, just gathering all the evidence, speaking to all the right people, and building a picture of what's actually happening.
Fantastic, thank you. Any other actions? Okay, and that is, oh, sorry, Chris. 2 people went in at the same time. Sorry, Chris.
Sorry, just based on experience and just picking up on what Fumi said, I'd also be making sure the coroner was aware, because if there are deaths, the coroner has jurisdiction, which everyone else needs to observe, and it shouldn't be assumed that the coroner already knows.
Very good point. Rena, did you still want to come in?
Yeah, I was going to say, do we need to then contact partners like CGL and Aquarius and ask if they can change how their workload and see whether they can increase outreach, and then also increase the naloxone? That's around and about.
Yeah. No, that is absolutely like I say, tailored this because it was so big from such different organisations. I thought we were going to get a real breadth of externals, but it's been fine anyway. So you're all right, and it's very much how our eldest operates. Is all these intelligence comes into our eldest. We have a rich partnership of everyone who is listed here, and you've mentioned, such as a queue and providers who can look at the information and look at the data and validate it and find out, like Glenda said, is it actually food poisoning? Is it a drug-related death? Coroners also do sit on our eldest, and Chris is right, it is normally one of our first checks is to go to the coroners to make sure they're aware because of their jurisdictions. So last slide, please. The reflections. So the reason why I brought in reflections is through working through this with the JCUD was something that was really tied was, did your response to the situation changed? So did your response to 2 rough sleepers passing away change to how 5 teenagers changed? Because as rightly advocated, that the substance may not be the same and it might be something different, but do we all become more concerned? Sorry, another person telling me they can't get in. Did your response to the situation change? Is it the cohort that changes? And like Chris said, is it different if the death changed? The other thing that we also want to take the time to kind of advertise for this Lunch and Learn is that we have created a online form for people to report incidents into us. Sorry, I'm just dropping it in the chat now. And as such, what this incident allows it to do is for it to report into our eldest. This allows people to make, if they so wish, anonymous reports of any overdose or death, and can be used and will report. That feeds our system of intelligence and the prevalence of risk that we have out there. We have discussed this wider with our partners before once, and I know there was concerns about duplication, but we have taken steps to ensure that any duplicate reports will be managed by the team and that it will only be responded once. Sorry, breathtaking amount of people messaging me, telling me they can't get in. That is what an eldest is. That's how it operates, and that's the information that we receive on a kind of daily basis, and how we work. Is there, next slide please, Georgia, any questions? Thank you, Glenda, for sharing that too. We'll put that on our communications as well. I think that's it. That's thank you very much for attending.
Thanks, Candice.
Thanks,
Thank you,
Candice.
Glenda. Thank you. Bye.
Thanks,
Bye,
Candice.
take
That's
care.
really helpful.
That's great.
Thank you.
Bye.